And with that new vaccine comes new hope to end the pandemic. We're joined this morning by our Chief Health Editor, Dr. Partha Nandi. Dr. Nandi, thank you so much for joining us this morning.
Hey, good morning. How are you?
What can you tell us about the Johnson & Johnson vaccine? How much different is it from the Pfizer and Moderna vaccines that are already being used?
First of all, Keenan, I'm just excited that we have another choice, right? Another weapon against this fight. So here's, to me, the main difference of how the vaccines are made. Remember that the Pfizer and the Moderna vaccines are made using what's called mRNA technology. No viruses involved. Whereas the Johnson & Johnson is a different vaccine type. It uses a harmless engineered adenovirus, right? But both of them actually are using genetic material to have human cells make spike proteins. And those spike proteins trigger the body to make antibodies. The other difference, the key difference also, is this, that Moderna and Pfizer, you have to take 2 doses, right? Several weeks apart. With the Johnson & Johnson, bam, it's just 1 dose. So it's 1 dose and you're done. So it's really, really effective. So last thing I'll say is that now, with Johnson & Johnson saying that they can get 120 million doses of this by June, that means we're getting closer and closer to that herd immunity and getting more people immunized.
All right, that is fantastic news. Now, some people will hear the effectiveness of the vaccines. The Johnson & Johnson vaccine, 66% effective at preventing any illness at all. And people may think that sounds a little low. But help put that into some perspective for us. What does that number really mean? And is it low?
Yeah, you're absolutely right. It's a great question. So 66% is right lower than 94 or 95% for the Moderna and Pfizer. But you have to take this into consideration that when the Johnson & Johnson trials were happening, we had the variants. Remember the variants that we know about from Great Britain and from South Africa. So that could be in part why you have a lower efficacy rate. We don't know that. But here's the bottom line, Keenan, is that 85% efficacy against severe disease, right? My patients, most people are worried about hospitalization and severe disease. That 85% effective. And also 0 participants who got the shot died from COVID-19. That's an amazing number as well. And lastly, the side effects, very, very minimal. Headache, fatigue, and arm pain. And remember, when you get those, it means your body's immune system is working. When I received the Pfizer vaccine, the second dose, I had fevers and fatigue, but it was short-lived, a couple hours and I was done. So side effects also are, I think, favorable for this vaccine.
All right. And, we already have the Pfizer and Moderna vaccine being rolled out that we're targeting the most vulnerable population right now. Who is more likely to get the Johnson & Johnson vaccine?
I think that, for me, it's whoever hasn't been vaccinated, right? So as we go down the line to get the less vulnerable, let's say, I think people are going to roll out the vaccine, but it's going to be there's going to be a point where you have 3 vaccines. And what I would say is that if there is a vaccine that's available for you, get it now. And that's the key. I think that lots of people are worried about the safety and efficacy of this. Remember, this is safe. I got it. My mom got it. I feel 100% confident this is going to be safe for all of us. And also, we have to remember that when the trials were being done, right, production was being done at the same time. So I'm confident that if all 3 are available, I would be confident and be sure to take any of them just so we can get vaccinated, so we can get on with our lives and get protected.
All right, Dr. Partha Nandi, Chief Health Editor here at 7 Action News. Thank you so much for your insight on the new Johnson & Johnson single-dose vaccine.
Thank you. Have a great day.